Hi there, my name is Emily Gardner, and I'm a postdoctoral fellow with the BC Children's Hospital Research Institute. And I'd like to thank you for coming to take a look at our poster. Children with neurodisability have considerable and unique support needs, and we know that their caregivers encounter significant challenges with accessing information and services. One such well-suited initiative to meeting these kinds of service-related needs may be patient navigation. However, the application of patient navigation to the context of children with neurodisability is relatively new and rare. This suggests that other terms are being used to describe practices centered on connecting children and families to supports, as well as coordination among services. So this area of the literature is challenged in two ways. The first of which being that children with neurodisability are poorly represented at this time. And the second pertains to the fact that there seem to be a number of terms to describe related or aligned work, such as navigation, case management, and care coordination, for example, and that these bodies of literature are often siloed. So the current scoping review aimed to unpack and provide a degree of clarity to this range of terms. So we asked what terminology and what descriptions have been provided in the literature pertaining to navigation and navigation type resources, supports, and activities aimed at connecting children with neurodisability and their families to community-based supports and services. So the search strategy adhered to the Joanna Briggs Institute methodology for scoping reviews, and inclusion criteria specified that to be included, articles had to be peer-reviewed and published in 1990 or later. This review was specific to articles focusing on children and youth up to the age of 18 and had to describe actually connecting children and families to supports. So our initial search yielded just under 2,600 papers, of which 33 met our outlined inclusion criteria. So from the 33 included papers, a total of 20 unique terms were extracted that had been used to refer to connecting children with ND and their families to community-based supports and services. And you can see each of the terms in the word cloud. So in order to facilitate a more detailed conceptual analysis, these 20 terms were organized through a cutting and pile sorting approach amongst the research team into 5 thematically related groupings. So specifically coordination, which arose most frequently, followed by navigation, key working, coaching, and family support. And we also analyzed how authors described their utilized terminology using a constant comparative qualitative method, which revealed 4 central domains as underscoring this kind of work. So articles described providing information, advice, education, emotional support, and advocacy, working to facilitate integration and coordination both within and across agencies and systems, identifying family-specific needs, and working to reduce families' barriers. The work was guided by the principles of client direction, family-centeredness, and collaboration, and aimed to improve child and family health and well-being, their capacity, and their satisfaction with service. So it was interesting and somewhat surprising that only one article used terminology related to family support. And we suspect that this is most likely related to our inclusion criteria, that in order to be reviewed, a paper had to describe the actual practice of connecting children and families to supports in their communities. So family support may best be conceptualized as a higher level, sort of overarching umbrella term under which the various kinds of navigation, care coordination, coaching, and key working supports are situated. There was also significant overlap across the descriptions provided within the 5 categories of terminology, with very little to identify one as distinct from the others. So in reality, most domains were coded regardless of the particular terminology grouping. And importantly, the 4 domains identified provide an empirically informed conceptualization of these roles or practices, which has been lacking from the childhood neurodisability literature. So I'd like to thank you for watching this presentation. And I encourage you to leave a comment or post a question on the page, and I'd be happy to continue the conversation. Thank you very much.